currently working in a hospital as a clinical dietitian.
Registered medical technologist currently based in Surigao City.
Community pharmacist in Glovermines Pharmacy.
I am a staff nurse in SPSUH.
Pratic here in Cagayan de Oro Medical Center.
Hello, my name is BACALSO, a registered nutritionist dietitian, and I am currently working in a hospital as a clinical dietitian. So in a general perspective, we all know that dentists play a crucial role in our oral health. They are known to alleviate toothaches and help you build your confidence by restoring damaged or missing teeth. However, as a dietitian, you have encountered patients with periodontal disease or dental caries, which are among the most common dental issues. I have come to realize the importance of dentists in healthcare settings. So these diseases can be prevented with the guidance of dentists, as they can educate patients on proper oral hygiene practices to prevent the onset of other dental issues that could potentially impact other bodily systems. Therefore, dentists provide both preventative and curative care, helping to ensure overall health and well-being. Actually, I haven't yet had the opportunity to collaborate with a dentist in patient management or in any other professional context. However, I have encountered patients with dental issues, and it has made me realize the importance of collaborative care between the dietitian and the dentist. So from my perspective, dental issues often arise due to dietary habits unless they are hereditary, right? So since people will always eat, whether to live or simply to satisfy themselves, the role of dietitian becomes crucial in guiding patients towards oral health through proper nutrition. So this collaboration could potentially prevent or mitigate dental problems, ultimately benefiting holistic health. So the mouth is essentially part of the digestive system. And the first stage of digestion begins with ingestion, followed by mastication, where the teeth play a primary role. So during mastication, preliminary digestion occurs. So imagine if your teeth are not well, if you have poor dentition, or you may have struggled to chew your food. This means that your capability to digest food or absorb nutrients will also be affected, especially when this occurs chronically. It can lead to malnutrition. So this is how I envision myself as a dietitian collaborating with dentists in patient care. So diet and nutrition affect oral health and vice versa. So it's important for people to realize and be educated about certain nutrients that are essential for maintaining strong teeth and healthy gums. Additionally, there are foods that are cariogenic, meaning they can cause tooth decay, and cariostatic, which do not contribute to decay. So dietitians are there to help prevent the worsening of dental problems, while the dentists have a role in managing or fully treating dental diseases. So by working together, dietitians and dentists can develop an integrated preventive and treatment plans that address both the nutritional and dental needs of patients.
Hello and good day. My name is JAYSON PAREDES and I am a registered medical technologist currently based in Surigao City. So to answer the question, from my perspective, dentists play a crucial role in the maintenance of oral health. They are involved in the promotion of general oral hygiene, such as in advising how often to brush one's teeth or how to properly floss. They perform procedures for the diagnosis and treatment of dental conditions, and they engage in the restoration and alignment of teeth. Their services provide preventive benefits wherein long-term dental problems are avoided with early and regular interventions. Their services also provide functional benefits in a sense that restorative procedures can help patients regain the ability to use their teeth without distress. And lastly, there are also aesthetic benefits in a dentist's service, wherein one's confidence and appeal can be elevated with healthier teeth. So far in my work experience, I have not yet directly collaborated with a dentist in patient management, as most of the professionals that I have collaborated with at this stage of my practice are medical doctors and nurses. But I do hope that someday I may be able to collaborate with a dentist. No, I also have not. My current practice of medical technology has been limited to the context of the hospital, particularly in the clinical laboratory. Although if I were to share any recent encounter that I have had with a dentist, I do have one. during the first week of March actually, but I was the patient in that case. I had an appointment for dental prophylaxis as I was already due for one. Okay, so as medical technologists, our profession leans heavily on the diagnostic side of healthcare. We examine body fluids to help doctors diagnose a disease. So we mostly spend our time inside the laboratory. When speaking of collaboration between dentists and medical technologists, I can envision this collaboration to be either direct or indirect. A direct collaboration between medical technologists and dentists is possible in certain cases, such as when a dentist wants to know if a patient is safe to undergo dental surgery by requesting routine blood tests such as blood chemistry or hematology. Or in more serious cases, if ever dentists would find abnormalities or lesions in a patient's oral cavity, these can be sampled and sent to a clinical laboratory to be handled by medical technologists for examination, whether it would be tested for culture or cytology, for example. On the other hand, a more indirect collaboration can take place wherein the work of medical technologists impact the management of patients even without the direct interaction with the dentist. So to exemplify this, when a patient submits to laboratory testing, medical technologists would produce the laboratory results that a doctor uses in disease diagnosis. The doctor's diagnosis in turn are useful information when a dentist asks for the medical history of the patient, which allows the dentist to personalize their services to the patient depending on their condition. And I think that is all. I hope I was able to answer your questions. Thank you for your time.
My name is SHAINA. I am a registered pharmacist. I work as a community pharmacist in Glover Mines Pharmacy. My understanding of the role of dentists in healthcare is they are the one who is responsible in providing diagnosis and treatment of different oral health problems. Yes, I have collaborated with the dentist in patient management. Since our clinic has an on-duty dentist every Saturday, so we are the ones who dispense their prescribed medicine after every procedure, like with extractions. Yes, I have collaborated with the dentist in other professional contexts. I have joined a few medical and dental missions. So yeah, I have experience collaborating with other dentists as well. As a pharmacist, we are one of the frontliners in fighting or preventing antibiotic resistance. So we really encourage patients together with the dentist to finish their prescribed regimen.
Hi, I am Keen and I am a staff nurse in SPSUH. So, as a nurse, in healthcare team members, everyone is very important. Everyone has a specific role and everyone has the same level of significance. So, just like our nurses or doctors, so also our dentists, they are part of the healthcare team and so they are important. We are all important in healthcare team members. Yup, as for myself, but before, that was just very before pa, when I was in fourth year college, I think, last year pa. And as for professional context, I still had no history of working with a dentist as a nurse. But in our work, it's very important. It's very important to collaborate, to work with a dentist for our patients because for their dental care, for their mouth care. And did I envision myself working with a dentist for a patient care? Yes. I would love to. I would love to because and I'm looking forward to it. I am excited to learn more about our dental care. And yep, in our work, in our patients, not just for our patients, but everyone needs oral care, everyone needs dental care. So everyone needs a dentist. Yep.
Hi, I'm April. So I'm a tech here in Cagayan de Oro Medical Center. So my understanding of the role of dentists in healthcare is that they are responsible for providing oral health care. So sila ang nag-diagnose and nag-treat in terms sa oral problems. Isa po sila sa mag-educate. So, have you previously collaborated with dentists in patient management? Yes. Have you collaborated with dentists in other professional contexts? Yes. So, how do you envision your profession collaborating with dentists in patient care? Based on experience, since ako sa hospital to work, dili malikayan na there are people or patients asking unsay treatment sakit sa ngipon, kahupagagams, and other oral problems. Questions related sa oral. Then, I instantly recommend them to a dentist. It's better to be checked by them. There are some people, especially misaligned tooth and impacted wisdom tooth, na they wanted to have a panoramic dental images para makita rin daw nila hamon ng ngipon. As a tech, don't accept or took images of those people or patients without a doctor's request. So I think I envision my profession by telling people and patients na kung nasa regarding oral problems that they need to see a dentist. Also by educating them sa gagmay na ways para dili mo abot sa point na mahimo na siya sakit or disease.
Hello everyone, I am Jane Frances Denise Fugnit, a 5th-year dental clinician from Southwestern University, Finland. Throughout these interviews, it was fascinating to see how the role of dentist intersects with such a diverse range of healthcare professionals. One key theme emerged: everyone emphasized the importance of preventive care. The nurse, which is Mr. Kim, and the dietitian, which is Miss Ray, highlighted the crucial role of dentists play in educating patients on oral hygiene and its impact on overall health. The radiologist, Miss April, mentioned how early detection of dental issues through x-rays helps prevent more serious problems. There were also some interesting contrasts. While the pharmacist, Miss SHAINA, focused on collaborating with dentists and medication interactions that can affect oral health, the medical technologist, which is Mr. JAYSON, pointed out how dental procedures can sometimes impact blood work results. This highlights the need for clear communication and collaboration across disciplines. Perhaps the most surprising revelation for me was the dietitian's perspective on how oral health can influence nutrition. It emphasizes the interconnectedness of all aspects of healthcare. These interviews have definitely impacted how I approach future collaboration with other professions. Moving forward, I'll be more proactive in seeking out opportunities to share information and work together with dentists to ensure the best possible care for patients. Ultimately, understanding the diverse perspectives on dentistry reinforces the importance of interprofessional collaboration in modern healthcare. It allows us to provide a more holistic and comprehensive approach to patient well-being. By working together, healthcare professionals like dentists, nurses, pharmacists, dietitians, and more can create a stronger, more effective system for everyone. That would be all. I hope you learned something. Thank you.